Okay, part 3 of our presentation on hypertension is going to be on the signs and symptoms. Signs and symptoms. How do you know that you have high blood pressure? How do you know that one already developed high blood pressure? Let's see in very few slides, again, slowly, until we understand in a bigger picture, but going slowly without overcrowding our presentation and see. So the question is, how do you know that you have hypertension or one has hypertension? How do you know? What are the signs? What are the symptoms? Can you see it? Let's see one by one. We remember our engine here, generator, pumping blood. It's pumping. You see, it is our machine which is standing in the place of a generator, pumping water from the source and to the pipes, bigger ones, the medium, until it reaches the smallest ones. So the engine has to be functioning well. Now, if there is pressure now in these vessels, if there is a pressure because of the predisposing factors, because of the causes that we saw in the previous slide, what will happen? A person might feel just fatigue. You cannot read on your skin that you have high blood pressure. No, you just feel fatigue. Most of times we'll be having it for a long time until the body will get tired. If the body is tired now, that time you start having fatigue. You feel weak. You might have a confusion. Confusion because the pressure is too high in the brain. The brain is under attack of a pressure which is too high. You might present with nosebleed. Why? Because the small vessels which are not hard enough, they can rupture. So sometimes they can rupture in the brain, they can rupture in the eye, they can rupture in the kidney, they can rupture on the heart, so they can rupture in the nose. That's why you might see a patient presenting with bleeding, nosebleed, and when you check blood pressure, you find that it is very high. Chest pain, if there is a pressure in those small vessels on the heart, for sure it will cause pain. These are the different symptoms that the patient can tell you, I'm feeling this, or start seeing one image, a patient might see two in one, or you see just a cloud, pleural division, you might see blood in the urine. Same way as nosebleed, if the vessels in the kidneys are getting damaged, so then the bleeding will happen. You might see blood with eyes, or you might not see the blood. That's what we call microscopic urine, blood, hematuria, microscopic. It's too small, the amount is not too much that you see it, but the test that we do, that you can do at the hospital, it can show that there is blood in the urine. So unless it is too much, that would call it macrohematuria. That will be too much. Now, severe headache. If that pressure is too high and the body is fighting too much, the response, the head, the brain will inform you that there is a problem. So you have a headache, might have a difficulty in breathing, especially if the hypertension now has started causing the complication on the lung. We will see the complications, how it can reach the lungs. You see, irregular heartbeat, because now the heart is getting confused, because it has been beating for a long time and until it got tired. So we are having a long list of what? Of symptoms. So this brain, if the pressure is too high, it's a battle going on, which will eventually interfere with the function. Remember, in the brain, there is electricity that keeps on going, controlling the whole body, networking, organizing everything in the body. So imagine now if the head is under pressure, it will be a serious problem as well. So The bottom line, when we talk about blood pressure, which is elevated, which is hypertension, which is high blood pressure, the problem will be in the capillaries, in the small vessels. You can see here there are arterioles, which are capillaries, and these are venules. So at the end of each organ, end, whether brain, the eyes, so if these capillaries are damaged, suppose like they are ruptured, eventually the blood will start leaking out. It will bleed. That's what we are going to see when we talk about a complication. We'll see a little bit into details. We'll see a little bit. So it's very important to check your blood pressure to know what do you really have. You don't even need to wait until you are sick to go to hospital. It's very important to check and check what is your value. Are you in the green zone, or are you in the yellow, or you have already entered in the red? So we wish to be in the green, all of us. If not, just slightly a little bit in the yellow, slightly a little bit. By the time you jump into red, hypertension stage 1, already 140 and 90, the lower one, then becomes a problem. The severity is becoming more seriously when the BP goes higher and higher. Thank you for following this part again. I hope it was clear, and I hope you will ask the questions. Opportunities are for you, and I always ask friends to come on board. Let's drive this together. Thank you so much for being part of this project of fighting diseases that are affecting us, affecting Africans in particular. Why? Because we have very poor countries. We have enough problems that we don't need additional problems. Thank you.